One thing with observing various limb lengthening patients, Instagram pages, and other case studies is that sometimes they have issues with the osteotomy healing. And going over my notes, I saw a paper that potentially suggests that LSGL, or as the two authors of the paper call it, joint loading modality, could potentially accelerate that recovery. The paper that alludes to this is called Effects of Surgical Holes in Mouse Tibia on Bone Formation Induced by Knee Loading. And a surgical hole is kind of like an osteotomy. So loads applied directly to the knee loading have recently been demonstrated to induce anabolic responses in femoral and tibial cortical bone. Now, they suggest that this is lateral loading. In order to examine the potential role of intermedullary pressure in generating these new loading responses, we investigated the effects of drilling surgical holes that penetrated into the tibial medullary cavity and thereby modulated pressure oscillation. So what they were testing was whether if you drill a hole in it, there's going to be less pressure in the tibia. So they wanted to see whether the effect of knee loading was due to pressure oscillation. And as suggested later in the study, it is due, knee loading's effect are due to the fact that it increases pressure in the medullary cavity. But that's not what I'm primarily looking at this study. I'm looking at the effect of how it heals surgical holes and the effect of what it can do to potentially limb lengthening patients. But it also means that if lateral loading works by increasing intermedullary pressure, then other methods such as axial loading even, or muscular contraction, which also increase intermedullary pressure, can also accelerate healing. But the issue is, which is the best? And I also think torsional loading is better because that increases the so fluid moves from areas of compression to areas of tension. And what's the best way to create the most compression and tension areas of the bone? Well, that's torsion. But the issue is whether a limb lengthening patient with the rod limits and getting back on the feet, whether they can even do torsional or heavy axial loading. And lateral loading is basically a way to get this loading stimulus without having to do very strenuous physical activity. So that's why I think this could be a potential benefit for limb lengthening patients. And here, compared to ulnar axial loading, for instance, joint loading requires a smaller force, 1/4 or less of the force required with ulnar axial loading. So right here, joint loading is already beating axial loading, which most people do in the gym. So yeah, it would be a great potential benefit for limb lengthening patients, and induces minute strain, less than 30 microstrain at the site of bone formation. So lateral loading can increase bone formation at the need of less strain. So it's very beneficial for people who can't do strenuous activity. So already right there, for limb lengthening patients, it could be a great benefit. Sideward loads are applied directed to the distal femoral epiphysis together with the proximal tibial epiphysis. So because the loading area is so wide, it loads both the femur and tibial epiphysis at the same time. It also loads the cartilage, but that would not increase the intermedullary pressure. So fluid flow moves areas of bone from fluid from areas of compression to areas of tension. And by laterally deforming the epiphysis, you're creating that area of compression. Again, I think torsion is better because it can create the most areas of compression and tension in the bone at the same time. But lateral loading does do sufficient, especially since the epiphysis is the most easily deformable area of the bone, having less cortical bone and being the most trabecular or spongy bone. Since the loading site and the epiphysis and the region of bone formation are structurally simulated, biophysical and biochemical mediators likely connect these two locations. I think that means that there's likely some sort of crosstalk mechanism. Knee loading induces alteration of intermedullary pressure in the femoral bone cavity, and this alteration is synchronous to the loading frequency in hertz. So the degree of frequency is likely a benefit. And also, if you're thinking of intermedullary pressure and fluid flow and stuff like that, fluid flow moves moving from compression to tension at the same time. The greater the frequency that the bone is altered, there's likely more degree of movement. So that's why I'm exploring vibration too. And I think vibration in terms of limb lengthening patients is a possibility, as it could potentially provide without breaking the nail. A pressure gradient elevated by venous ligation was shown to increase interstitial fluid flow, and this flow mediated bone adaptation was considered to be independent of mechanical strain. So they have, in other scientific studies, have shown that it's possible to induce bone formation without mechanical loading. So mechanical loading, I think, but by what I've seen, it indirectly, not direct. Well, it may directly, but the it's the primary mechanism of action is via this fluid flow, not via microfractures or whatever. It's via this fluid flow, and that's what causes the bone adaptation. I think if the interstitial fluid flow is sufficient, it can also increase height and size of the bone. But that's not the point for me bringing this paper up here. The point is to sort of say that, LSTR, joint loading modality, may have potential to accelerate recovery in limb lengthening patients. Intermedullary pressure is therefore likely to be a potential mediator for knee loading driven bone formation. So yeah, knee loading driven bone formation may have direct effects, but the intermedullary pressure alteration is likely to be a big cause of it. Here they explore methods. Penetrated single surgical hole 0.5 millimeters in diameter was drilled with a new drill bit from the medial cortex into the opposite posterior cortex. So this is kind of like the limb lengthening surgery in that they have the osteotomy, and this is a surgical custom-made piezoelectric mechanical loader and knee loading, which is listed as described previously. There's tons of LSTO, or as Zanga Yakulta, you have to call it, joint load modality studies. Loads were applied for 3 minutes per day for 3 consecutive days to the leftly in the lateral medial direction. The loading frequency was 5 hertz. That's 5 cycles per second, and the peak-to-peak force was 0.5 newtons. 5 cycles per second is a lot. So that's why, I'm thinking of a external vibration for my own methods. But it may be possible to get results with less frequency, but that would have to be studied. Here they go over. So yeah, without the hole, there's more bone formation. So it shows that knee loading is impacted by intermedullary pressure. So here's the key sentence. No, not quite. Cyclic deformation of the epiphysis alters pressure in the medullary cavity, and the pressure gradient induces fluid flow in the diaphysis. So they're saying that LCO, or joint loading modality, works by deforming the epiphysis, and this creates a pressure gradient that drives fluid flow in the diaphysis. As I said again, fluid flow flows from areas of compression to areas of tension, and I think that torsion is the best way to create this, as torsion is going to create the most areas of compression and the most areas of tension. But lateral loading has a benefit in that epiphysis is most easily deformable. You're targeting the most easily deformable area of bone. But here's a key sentence, and I have a bunch of errors. We observed a tendency for the holes in the loaded tibia to become smaller with knee loading than the holes of controls. So this indicates that possibly LCL, or joint loading modality, can help recover from the osteotomy in limb lengthening surgery. It might be easier to transmit a pressure signal over a cartilaginous growth zone than ossified growth zone due to load of mechanical impedance. This indicates that people with open growth plates may get more benefit from joint load modality, or LSTL, than people with closed growth plates, but it does not mean that people with closed growth plates would get no benefit at all. Here you can see the joint loading apparatus applied. Um, so what's key here is that these rats are not like doing like other strenuous exercises. They might be doing light exercises, but they're not like doing like the kind of exercises that we do. So the question is whether this knee loading beats heavy muscular contraction in terms of driving intermedullary pressure, and that's a big question. But with limb lengthening surgery, you're not going to be able to do those things, at least right away. So lateral joint loading just has to beat that. And I think with this study, we can say that, yeah, it can beat that, at least for that short period of time. I mean, but once you get muscular contraction, we need to be doing studies to see which is the best, whether it's torsional loading, whether it's heavy muscular contraction, maybe it's electrical stimulation. But yeah, I think right now for that initial recovery phase, lateral loading is right there in the mix. Here you can see knee loading without a surgical hole and the benefits, and the increase in bone formation. This is control tibia versus loaded tibia. What's interesting is that little hole that's created right here, and in this study I've always found that hole interesting. Whether joint loading creates those holes by increasing osteoclast activity, and that's part of the reason why I think that interstitial fluid flow could possibly increase height. In that it increases that osteoclast activity and enables bone to remodel into a taller, longer shape. Here you can see, this is the one with the surgical hole. You can see the surgical hole kind of getting smaller in that enhanced bone formation. This is the cross section of the control tibia, control tibia with a surgical hole, cross section of the loaded tibia at 50% site. So yeah. Oh, okay. But here, micro CT of the hole in the medial surface of this on the surgery day, micro CT of the hole in the posterior surface on the surgical day, micro CT of the control tibia in 1 week after surgery, micro CT image of the loaded tibia in 1 week after surgery. So you can see it's a lot smaller. So, joint loading or lateral joint loading did manage to accelerate that bone formation. So, yeah, so that would be the exciting element for limb lengthening patients. So the paper goes on to explain more data. Yeah. So I think, if you're a prospective limb lengthening patient who wants to accelerate their recovery, I think if you potentially show your surgeon this paper and say you wanna try, you think this method could potentially accelerate your recovery, I think that would be a very uncontroversial thing to do. And you could go with talk with your doctor of a potential way to incorporate this method to accelerate your recovery, and talk about this paper with your doctor. And I think that's a very uncontroversial thing to do. Some of the things I say may be controversial, but I think if you're a limb lengthening patient, you print out this paper and you say, okay, I saw this paper and I saw that this method could potentially make the bone heal faster. Do you think we can incorporate that? I think that's a very uncontroversial thing to do, and I think potentially some lengthening patients should try doing that. So yeah, I think there's a lot of this paper is very interesting. I think